This presentation is to educate the community about syphilis presented by nursing students of Delta College. The causes of syphilis caused by the bacterium Treponema pallidum. It is transmitted through contact with an infected person's sores during sexual activity. Can also be spread through an affected mother to her child during pregnancy or childbirth. Primary stage begins 3 to 4 weeks after exposure. The first sign of syphilis is a painless sore that appears at the site of infection, called a chancre sore. Easily treated, contagious during this stage. Secondary stage occurs 4 to 8 weeks after the appearance of the primary chancre. People will begin to experience a rash that begins on the trunk, but eventually covers the entire body. The rash is a rough red or reddish brown color that appears on the palms of the hands or the soles of the feet. Some people may experience hair loss, muscle ache, fever, sore throat, and wart-like sores in the mouth or genital area. Symptoms may disappear within a few weeks or can come and go for a year. During this stage, a client infected with syphilis is still contagious. Latent stage. Considered early if it begins less than 1 year after being infected. Considered late if it begins after more than 1 year since being infected. The syphilis bacteria are still alive, but there is no signs and symptoms. You are not contagious during this stage. Signs and symptoms may never return or may progress to the third stage if untreated. Tertiary stage can occur 3 to 30 years after initial infection. 15 to 30% of the people infected with syphilis will develop late syphilis. Occurs due to lack of treatment, may damage any of the organs, including the brain, nerves, eyes, heart, blood vessels, liver, bones, and joints. Tertiary stage can lead to dementia, blindness, and numbness. If left untreated, syphilis can lead to death. Ways to prevent syphilis and protect yourself. There is no vaccine for syphilis. To help prevent the spread of syphilis, follow these recommendations. Abstinence is the only certain way to avoid contracting this disease. Monogamous. Remain intimate with one partner. Practice safe sex. Condoms can reduce your risk of contracting syphilis, but only if the condoms covers the syphilis source. Avoid recreational drugs. Excessive use can cloud your judgment and lead to unsafe sex. Early signs of syphilis. The earliest signs of syphilis is a chancre. A chancre is a small sore that grows where the infection enters the body. This can grow on the vagina, penis, rectum, mouth, or hands. Most people only develop one chancre, but in rare cases, multiple can grow. The chancre will heal itself in 3 to 6 weeks, but does not mean that the infection is gone. Enlarged lymph nodes near the groin can also be a sign of syphilis. Late signs of syphilis. A skin rash that looks like small red, brown sores that are in the mouth, anus, penis, or vagina. A fever, weight loss, swollen lympho glands, hair loss, and fatigue are also symptoms. Severe symptoms that can happen if not treated are strokes, infection around the brain and the spinal cord, deafness, numbness, and visual problems. Treatment. Syphilis is treated with antibiotics for early syphilis or early latent syphilis of less than 1 year duration. A single session of IM injection. Patient with latent or latent syphilis of unknown duration should receive 3 injections at 1 week intervals. Patient treated with penicillin is monitored for 30 minutes after injection to observe for any allergic reactions. Special guidelines are provided for treatments in the settings of pregnancy, allergy, HIV, pediatric infection, congenital infection, or neosyphilis. Neosyphilis treated with antibiotics via vein or daily IM injection for 10 days to 14 days. Medication. Penicillin G benzathine is a medication of choice. If allergic, then doxycycline can be used. Patient education. Having syphilis once does not protect you from getting it again, so protect yourself. Condom significantly reduce the risk of transmission of syphilis and protect you against other STDs as well. Having multiple sexual partners can increase the risk of acquiring syphilis and other STDs. Complete the full course of antibiotics. Refrain from sexual contact with previous or current partners until the partners have been treated. If you are pregnant, seek treatment right away. Follow up testing is recommended to ensure that treatment was successful. Who to contact? California Department of Public Health or San Joaquin County Public Health. Resource: Safe Lab STD Testing Center, Planned Parenthood North Stockton Health Center, Planned Parenthood Eastland Plaza Health Center, and Quest Diagnostic Stockton East Magnolia.